Welcome back to Have More Babies. We're here to give you, well, practical wisdom, crucial insights into raising healthy, happy kids.
It's a journey, isn't it?
It definitely is. And today we're diving into something that honestly makes most parents just a little nervous.
Oh, yeah.
Broken bones or, fractures,
Yeah.
as the doctors say. It's actually pretty common for active kids.
Surprisingly common, yeah.
So our mission today, we want to give you a really clear, concise rundown of childhood fractures. What are they? Why do they happen? How do doctors figure it out? And what does treatment actually look like?
Good plan.
We're pulling our info from a really detailed guide by Omega Pediatrics. They're a great resource for families. Okay, let's unpack this.
Sounds good. And it's true. Fractures feel scary, but they're almost an expected part of childhood for a lot of kids. They explore, they push boundaries.
They climb on everything.
Exactly.
Yeah.
And sometimes, those adventures end with a tumble and a bone injury, that initial panic.
Yeah.
Totally normal for parents.
Oh, absolutely.
But, having a good handle on what you're actually dealing with,
Yeah.
that can really help lower the stress and help you act fast.
Definitely. So let's start right at the beginning. When we say fracture, I think most of us picture like a clean snap, like in the cartoons.
Right, that traumatic break.
Yeah. Is it always like that? Or can it be something, I don't know, more subtle? Maybe something you might even miss at first.
That's a really important point. And it's often misunderstood. A fracture isn't always that big dramatic event.
Okay.
As the Omega Pediatrics guide points out, a fracture is simply any break in the bone, period.
Any break.
Any break. And that covers a huge range. It could be a tiny, tiny hairline crack, sometimes called a stress fracture, that maybe just causes a bit of discomfort, hard to even pinpoint. Or, it could be that complete separation where the bone pieces are totally shifted.
Wow. Okay.
The key thing for parents to get is that even a break that seems minor, if you don't get it checked out or is not treated right, it can cause problems later, especially for a growing kid.
Right, because they're still developing.
Exactly. And the signs aren't always obvious. It might not be intense pain. Sometimes it's just, the child doesn't want to use their arm or they're swelling or it's tender to touch. So even if you just suspect something after a fall, it's worth getting it looked at.
That makes total sense. So it's definitely not just broken or not broken, lots of gray area.
Precisely. Nuance is key here.
Okay, and speaking of nuances, the source material we looked at mentions different types of fractures, especially thinking about kids' bones, which are different from ours,
A
right?
little different, yes.
So how do these types differ? And I think there was one type that's particularly common in little ones.
Yes, that's right. The guide outlines 3 main types. And knowing the difference is important because it really guides the treatment and how urgently you need to act.
Okay.
So first up, you've got the simple fracture. This is probably what most people think of. It's a clean break, the bone snaps, but crucially, there isn't much damage to the muscles or skin around it. The bone stays inside. Exactly. These are usually pretty straightforward. Immobilize it with a cast, let it heal.
Got it.
Then you have the compound fracture. Now this one is much more serious, needs immediate medical help.
Okay.
This is where the broken bone actually pushes through, breaks the skin. It's basically an open wound with bone exposed.
Oof. Yeah.
The big worry there, besides the break itself, is infection, bacteria getting in. So these almost always need urgent attention, often surgery.
Right. Makes sense. And the third one, the one common in kids.
Yes, the green stick fracture.
The green stick. Okay, here's where it gets really interesting because that name alone paints a picture, doesn't it? It sounds like it relates to how kids' bodies are unique.
It's a perfect analogy, actually. It really is.
Yeah.
It comes down to how bones develop.
How so?
Well, think about trying to snap a young green twig off a tree.
Okay. Yeah, it doesn't snap cleanly. It bends.
Exactly. It bends and it splinters on one side, but the other side often stays connected.
Right. It just frays.
That's pretty much what happens with a green stick fracture. Kids' bones are still growing. They haven't fully hardened like in adults. They have more flexible cartilage, and that outer layer, the periosteum, it's thicker and stronger.
Okay.
So when they fall or get hit, their bones are more likely to bend and crack only partway through rather than snapping completely in two.
So it doesn't fully separate.
Correct. Now, while that might sound less severe, they still need careful treatment. You got to make sure it's aligned properly, especially considering their growth plates, those areas where new bone forms. Proper alignment is crucial so it doesn't affect how the bone grows later on.
That's such a clear image. Really helps understand why it happens more in kids. Wow, their bodies are amazing, but still, developing.
Absolutely. Resilient, but still vulnerable in some ways.
So we know the types now. Let's talk about how these little adventures actually end up with a broken bone. What does the Omega Pediatrics Guide say are the usual culprits, the common causes? And maybe, are there things parents can do to, lower the risk without bubble wrapping them?
Huh? Yeah, the bubble wrap temptation is real. The guide points to three main causes, and they really do reflect that active kid lifestyle you mentioned.
Okay.
By far the most common cause in children. False.
Not surprising.
Not at all. And this is super broad, right? It could be a toddler tripping on the playground rug, a kid learning to ride a bike and taking a spill.
Or just missing a step on the stairs.
Exactly. They're constantly testing limits, exploring, and sometimes, well, gravity wins. You can't stop every fall, obviously.
No way.
But things like making sure playground equipment is safe and age-appropriate, teaching kids how to fall properly if they do sports, basic child-proofing at home that can help minimize the risk of a serious injury from a fall.
Right, reducing the severity, maybe. What's next?
Next up is sports injuries, especially contact sports.
Ah, okay. Football, soccer.
Soccer, basketball, gymnastics, even just rough play. Lots of speed, sudden stops, twists, collisions. It puts a lot of stress on growing bones.
Yeah, you see it happen.
Good coaching, making sure they have the right protective gear, teaching good technique, all that helps. Simple things too, like making sure soccer goals are anchored properly can prevent a really bad accident.
Good point.
And the last one.
The last category, thankfully less common but often more serious, is other accidents. Things like car crashes, maybe being hit by a car as a pedestrian.
Oh, wow. Yeah.
These are usually higher impact, can cause more complex fractures, often need more involved medical care. Really underscores the importance of car seats, booster seats, bike helmets, traffic safety, all that crucial stuff.
It really does show how their natural energy and curiosity, which is wonderful, also just comes with some built-in risks. Okay, so we know what it is, why it happens. Let's move to the next big step. You suspect a fracture. How do doctors actually confirm it? And then what's the road to recovery usually look like for a kid?
Right. This is where the medical team steps in. It's obviously super important. The diagnosis part is usually pretty straightforward, but, sometimes there are challenges, especially if it's a subtle break or the child is very young or scared.
Sure. The first and most common tool is the X-ray. No surprise there.
Standard.
Yep. Gives a clear picture of the bone, lets them see the break, where it is, what type it is, how bad it is. It's fast, doesn't hurt, and usually tells them what they need to know for most simple fractures.
Okay.
But it's worth mentioning, sometimes maybe with a very fine hairline fracture, or if it's right in a joint, the X-ray might not show it right away.
Really?
Yeah, so the doctor might say, let's wait and see. Maybe cast it based on suspicion and re-X-ray later, or if they're really suspicious, they might go to more advanced imaging.
Like what?
Well, for more complex situations, or if they think there might be damage to ligaments or tendons around the bone, or if the break is tricky, they might use an MRI or a CT scan.
Okay. What's the difference there?
So think of an MRI as being really good for looking at the soft tissues, muscles, ligaments, cartilage. Super important if they suspect joint damage or injury to a growth plate. A CT scan gives more of a detailed, 3D picture of the bone itself. Really helpful for complex breaks or figuring out if surgery is needed to line things up just right.
Okay, that makes sense. So once it's confirmed, treatment time. What happens then?
Treatment really depends on the break, the type, where it is, how severe, and also the child's age.
Right.
For most simple fractures and those green stick fractures we talked about, the standard is casting.
The classic cast.
The classic cast. Plaster or fiberglass. The whole point is just to hold the bone still in the right position so it can heal properly. And kids' bones heal incredibly fast, often way faster than adults.
Why is that?
Those active growth plates, again, they're just churning out new bone.
Right.
That rapid healing is why casting works so well, but it also means getting that initial alignment perfect is really critical to avoid problems down the road.
Okay. What about the more serious ones, like the compound fracture?
Right. For compound fractures or breaks that are really complex or out of place, surgery might be needed.
To fix it internally.
Exactly. Maybe to realign the bone pieces, sometimes using pins, plates, or screws to hold everything stable while it heals. Especially if the break involves a joint or is badly displaced, that recovery involves careful wound management too.
Makes sense. And then what, after the cast comes off or after surgery?
Then comes a really important step, Physical therapy, often recommended, especially after longer immobilization or
To
surgery.
get moving again.
Yes, but it's more than just strength. It's about getting back the full range of motion, flexibility, coordination, making sure the child can get back to their normal activity safely without hurting it again. It's like the bridge back to normal life.
So what does this all mean for you, the parent listening? It really hammers home that getting the right diagnosis quickly and then the right treatment is just so crucial for your child's recovery.
Absolutely. The right plan makes all the difference in getting them back on their feet, playing, exploring.
Yeah, back to being kids as soon as possible. And it also kind of highlights the bigger picture of healthcare for kids, doesn't it? Which is something the Omega Pediatrics material really touched on, beyond just fixing fractures.
It really does. I mean, understanding fractures is obviously key for parents,
Yeah.
but the guide also shows how Omega Pediatrics looks at the whole child. You know,
Yeah.
their health is all connected. A broken bone isn't isolated. It affects how they move, their mood, maybe even eating habits,
Sure.
which is why their services go way beyond just handling injuries. Like, they offer newborn circumcision and lactation services. That's foundational stuff, right, from day one, setting kids up for good health.
Right, for the start.
And then they cover everything day to day. Acute pediatric care for when your kid suddenly gets sick, fever, cough, whatever. And preventive pediatric care, regular checkups, making sure they're developing well, keeping them healthy long term. Even with a fracture, good overall health helps healing.
Makes sense.
Plus, recognizing that kids get sick or hurt at inconvenient times, they have essential after-hours pediatric care. Huge peace of mind for parents when something pops up late at night.
Oh, definitely. Been there.
And things like complete immunization and vaccine information, absolutely vital for protecting kids from serious diseases so they can stay active and healthy. They even address things like obesity medicine, which is important because sometimes recovery from a fracture can limit activity and affect weight, and even medical ear piercings.
Wow, really?
Yeah, it shows they're thinking broadly about family needs, medical and otherwise. It really paints a picture of comprehensive support, looking at the whole child, the whole family picture.
It absolutely reinforces that idea of being a complete resource for families, covering everything from those unexpected bumps and breaks to just routine wellness, growth, development, supporting the family through it all, making sure one setback, like a fracture, doesn't throw everything off course.
Exactly. It's holistic care.
Which brings us to a final thought for you, our listener. We've covered a lot. Types of fractures, causes, diagnosis, treatment, the importance of that broader pediatric care network. But thinking about all this, about kids being active.
Yeah, it does make you think, doesn't it? It raises this question, how can understanding these common things, like fractures, empower us? Not just to react when something happens, but maybe to proactively support our kids' development, encourage their adventures, while also being, prepared, building resilience for those inevitable bumps in the road.
That's a great way to put it, finding that balance between letting them explore and being ready with the right knowledge and care. Okay, so quick recap. We unpacked what a fracture actually is, any break. We talked simple, compound, and those unique green stick fractures in kids. We covered the top causes, falls, sports, and other accidents. We walked through diagnosis x-rays, sometimes MRI or CT, and the key treatments like casting, maybe surgery, and definitely physical therapy.
Crucial steps.
And we highlighted how vital that comprehensive wraparound pediatric care is, supporting the whole child through recovery and beyond.
Being informed really is powerful. It helps you advocate for your child and ensures they get back to being themselves quickly and fully after any setback.
Absolutely. And for much more detailed information on all things children's health, including really thorough guides on fractures, explanations of all those services we mentioned, and just a wealth of knowledge, we strongly recommend you visit omegapediatrics.com.
It's a fantastic resource.
Truly invaluable for parents. And hey, if you found this useful today, if you learned something, please take just a second to like this video, subscribe to our channel for more deep dives into parenting and child health, and please share this video with friends, family, anyone you think could benefit from knowing this stuff.
Thank you so much for tuning in and joining our discussion today.
Until next time, stay curious and keep diving deep.